Athletes get it sometimes. Vets can get it too. We're talking about ACL injuries. Good morning, Doc.
I thought you were going to say athlete's foot for a second.
Well,
yeah, ACL injury, and we hear this one. This is another one of those words we banter around. And so what ACL stands for is Anterior Cruciate Ligament. Now in dogs, the other term that we use is Cranial Cruciate Ligament, or CCL. But ACL is easier because there's also a caudal cruciate ligament. So when you say CCL, that could be cranial or caudal, so confuses people. So an ACL, so when you say anterior, that means in front. Okay. All right. And then the cruciate ligament, there's two, okay, in your knee. And do you remember the old Chinese finger snare? I'm sorry, not the finger snare, the Chinese wallet. You get them at the fair, it's little two boards with the ribbons, and you'd open them, and they had little ribbons. Okay, and they kind of crisscrossed, and that's how it made a hinge. That's exactly how that knee works, okay? So the two ligaments cross each other. That's where they get the name cruciate from, okay? And they just kind of flex back and forth. So that allows these two bones, the bottom of your thigh bone and the top of your shin bone, to flex. Because if you can imagine, if you're at home, take two fists, put them face to face each other, and roll them back and forth. That's basically your knee joint.
And that's how you want it.
Well, you want it to roll back and forth like that, right? And what happens, the only way to do that is to have some attachments there. So the structures that hold that together, you have the two cruciate ligaments. You also have two lateral. You have ones on each side, the lateral and medial collateral ligaments, and then you have the actual patella tendon that holds all that in place. Okay, so when the ACL, the anterior one, tears, it allows advancement of that lower bone, the shin bone, forward. And what that does, it creates a sliding or drawer motion. And so when we diagnose this, one of the things we do is we lay them on their side and we hold those two bones and we see if we can advance that lower shin bone. That's called drawer sign. The other thing we can do is we can actually take the thigh bone, immobilize it, and flex the foot, and you'll see that shin bone push forward. That's called a tibial thrust. So those are two techniques that we use to diagnose it. It's the most common knee injury that we see. It is a repairable injury.
Okay.
And there's several ways to do that. In bigger dogs, certainly a technique called a TPLO, tibia plateau leveling osteotomy. TPLO is easier to say, is one technique. But then the other technique that we've used for quite a long time is an extracapsular repair, where we actually put a monofilament implant in there, and we tighten that up. And what it does is that implant parallels the actual path of the original cruciate ligament, and it holds in there. In the old days, we actually used to harvest fascia from the outside of the thigh muscle, and we actually would take that back through and use the dog's own fascia to create another ligament. That was very time consuming and probably no better than the monofilament. The monofilament, I think, probably is the most common one. But if you do tear them, what the dog looks like, they usually will carry it very high right afterwards. And just because you have a dog that tears an ACL, you may or may not choose to repair that. Some of the smaller dogs that are not very active, a lot of times they may not need the repair. Bigger dogs that are very active almost always need a repair on that. So, and again, too, you can have a partial tear, because this is a pretty wide ligament. So you get a partial tear, but eventually it's probably going to tear completely. So if you do have a hind limb lameness, that they're carrying it high, you might want to get that checked sooner than later, because the earlier you intervene with these, the better the success is.
All right, and we'll be back right after this message.